Paul. It is 3:13. All new at 3. Researchers are testing artificial intelligence to see if it can help doctors diagnose patients. A new study found ChatGPT was 72% accurate in overall decision making for textbook style cases. But in cases where there might be more than one diagnosis, the bot's success rate dropped to 60%. Now some doctors are questioning if AI will hold up in the real world. Joining me now is Mathew, an expert on AI in healthcare and the Chief Growth Officer at Sniffle. Chris, hello.
Howdy, Jamie. Happy Friday.
Happy Friday. What is Sniffle?
Sniffle is the country's first AI-driven virtual care platform. We have an app, Sniffle, for patients, where patients can download the app for free and really get visibility into what's happening in their own healthcare journey through our medically curated AI tool, which actually has a 95% accuracy rating on the return of the differentials for that individual.
Well, I was going to ask you what's your take on AI in medicine, but I think you kind of gave me a little bit of an insight on that. But how do you think we're going to be seeing AI be used in our patient care?
It's a great question, Jamie. At Sniffle, we really believe that a diagnosis is something that should only be provided by a licensed medical provider. An diagnosis is a term we've created, an AI-derived diagnosis. It's a tool. It's a support structure and a learning protocol to help us as patients really gain visibility into what's happening in current time. It should not usurp the expertise of a physician.
Okay, I like that advice. We've seen people kind of go to Google, start Googling things and go down that rabbit hole. I imagine they might be able to do that same thing with AI. So what do you want people to know when using ChatGPT or looking for some answers with a medical diagnosis?
Yeah. ChatGPT, WebMD, Dr. Google, all of this can sometimes be summarized as cyberchondria. You look up something that looks like a skin rash, and next thing you know, it's giving you a cancer diagnosis. The reality is, use it as information, but validate it with your physician.
We see medicine. I'm sorry, Chris. We see, robots doing surgeries now. So we want science in our medicine. We want our advanced technology in our medicine. Where do you think that we will see AI turn up first in our doctors' offices?
Well, it's already there. It's already being utilized. You mentioned robots are in surgery, but Jamie, was something really important. There's a physician driving the robot. There's always going to be a person, an empathetic person that has a relationship with that patient that'll always be utilizing AI as a tool. When you think about the first lab test or MRI machine or even the first stethoscope, it was probably looked at with some skepticism. AI is just another tool to help physicians do more with less. And we think it's going to be really great for all of us patients across the country.
Where do you think it will be helpful? Where do you think it could be harmful?
Well, I think sometimes people can get frustrated and overwhelmed with wanting to find a direct answer very quickly. Medical curation and really understanding information requires you to go deep. You need to have lots of diagnostics to be able to understand what's actually happening. People can be impatient, and sometimes no tool, even as smart as AI can be, can't replace the fact that you need to go through the time. But I do see that physicians, nurses, nurse practitioners, PAs, they're being burnt out all across the country. Throughout Arizona, there's a real physician shortage. AI is a tool to help physicians and nurses and nurse practitioners, et cetera, find a way to be able to do more with less and focus on the actual caring of people and allow some of the algorithms and the AI tools to do some of the heavy lifting, like that ChatGPT study that you mentioned with Mass General Brigham.
Mathew, we appreciate your insight on this. Very interesting. I think, AI is coming for us, so we got to be ready at Sniffle if you want to check out Sniffle. Thank you, Chris.
Thanks, Jamie.